To all our Herald TV viewers, a very warm welcome. You are watching a special program on sports, and that is Sports Talkies. We know that sportsmen would love to excel and they would love to be in the game for as long as they can, and their fitness gives them the ability to perform to their best levels. It calls for a lot of interventions. We talk about problems that a lot of players have because they have not been having good conditioning. So prevention is one of the main aspects of a performance, and most of the time, once you get injured, that's the only time that the athlete, the sportsman thinks that, okay, now I needed to go to the doctor and find out how can I recover, and everybody is in a hurry to recover in the quickest time as possible. Now, there are two aspects that you need to be prepared. Conditioning is necessary for the prevention and recovery, and should anything happen, then you definitely should undergo a good treatment. So the need of specialists, and the specialists for sports are those who have qualified in sports medicine, which is a special branch of medicine. We have with us a Goan, a very talented basketball player. Still he plays basketball, and he qualified as a doctor from the Goa Medical College in 2020. Since he was and still is a basketball player and had an injury that we will talk about it later on, he thought of doing a specialization in sports medicine. He was in London for 2 years, where he has done his specialization, his master's in sports and exercise medicine. And we are fortunate that he is here with us at Herald TV, and we welcome Dr. Nihal Fernandes.
Thank you.
Dr. Nihal,
Yeah.
it's nice to have you with us, our own Goan who specializes in this sports medicine, and I'm sure he will throw a lot of light, and new light perhaps, in treatment especially.
Yes.
You have just returned,
Yep.
and what is your objective now? How will you offer your services? Somebody wants to talk to you, somebody wants to be treated. Do you have any plans for that? Your own clinic or something like that? Can you tell us?
Yes, definitely. For now, I'm looking actually to one, working with a sports team, and two would be to start my own sports injury clinic where everyone, any athlete, right from the grassroots level to the professional level would be welcome. So that's what I'm looking to start. But as of now, it's
You are just taking the first few steps,
Yeah.
but you know what exactly you are aiming at.
Yes, definitely.
Do you think that there is actually need for a doctor with a team, a sports medicine doctor? Because most of the times in England, your Premier League and all those, they have a doctor always with them.
Yes, they do.
But it is not so in India. Even at the topmost level, we don't find a doctor assigned exclusively with the team.
Yeah.
Do you think that eventually there will be a need of a doctor with the team?
In my opinion, yes, definitely. A team needs a doctor for screening, to have immediate care if there's an injury, and even for preventive measures. So I think that a doctor is really important to be there in the team. I think, in my opinion, currently there are every team has physiotherapists, which is really good. But even a doctor along with a physiotherapist would benefit the team even more.
Much more.
Yes.
Because as of now, a physio is a must.
Yeah,
is a must.
Yes.
But for the foreign teams, they always have a doctor with them.
They do. Yes, they
and he's available for them for 24 hours.
24/7, yeah.
Now, actually, they borrow their physios,
Yeah.
and as and when they can use their services, they are called, and it is over. Whereas abroad, it is a continuous process. The monitoring does not start and end on the day of the match.
Yep.
What do you think so?
I think that it's not only about the day of the match. The screening needs to be started right before, well before the plan of the tournament has been devised. I think that they should be screened for all kinds of conditions that, nowadays there are a lot of congenital conditions that can cause an athlete or a player to suffer some injuries or to have problems that are uncalled for if the screening has not been done.
So you feel that conditioning, strengthening is
a must.
Very essential.
And screening most of all, because you need to screen them off for these congenital conditions or how prone they could be to certain injuries.
Yeah. When you talk about screening, your focus, which will be the focus area that you will concentrate on?
It's not just, I would say there's not just, you can't just focus on one area, you need to focus on multiple.
On general.
And in the general, you need to focus on their fitness ability, on their systems, that's their neurological system, their respiratory system, their cardiovascular system. All systems need to be well assessed and looked for problems.
It's your body that has to perform.
Yes, exactly.
So that would include, as you say, your neurological, your breathing, respiratory, cardio is important, and also your muscle mass also.
Yes, definitely. That's why I said your musculoskeletal system as well.
Yes.
So that's really important.
That's important.
Important, yes.
And do you think that all those who play, whether it is amateur or professional, even at the school level or college level, would it be advisable for all of them to go through some tests?
Yes, I think everybody should go through some amount of medical fitness if they're going to engage in a sport, especially if it's a team sport where there's hard amount of contact. So I think that such athletes who are engaging in these sports or even other sports in general need to go through some level of medical screening.
I know, for example, in football, at the lowest level, it's just asking the doctor, give me a certificate that this player is medically fit. Whereas at the higher level, the FIFA, for example, they have got a
Screening protocol.
And they have to do a lot of tests, including our ECG, stress test and all that. And in some cases where they have heart problems, which are hereditary or genetic, then even they prescribe Holter ECG and things like that, which they do. And now more so because there have been a lot of sudden deaths, then cardiac arrests and heart attacks on the play field. Do you agree with screening on this aspect?
Yes, very important. In fact, quite recently, there were in the last 3 years, there were quite a few number of sudden cardiac arrests that happened on the football field where a couple of players just
we had Christian Eriksen from Denmark.
Exactly.
And a defibrillator has been implanted. And then earlier in Goa, we had Cristiano Jr. I don't know whether you are aware of that. He played for Dempos, a Brazilian.
Yes, Brazilian.
He was playing in the finals of Federation Cup in 2004 in Bengaluru. He scored the second goal and he collapsed. He died. Those who were there around did not know what to do. The CPR was unknown at that time. He was shifted to the Fortis Hospital in Bengaluru 30 minutes later, and the doctor said he was brought dead. So now they say that there was a need to do the proper medical inspection, especially concerning the heart. Do you agree with that?
Yes, I completely agree. There are a lot of conditions that could predispose an athlete to this particular condition that happens. It's called sudden cardiac arrest. Now, apart from screening for this specific condition, the sudden cardiac arrest, like you mentioned, one of the most important thing to have in a sports facility where a particular game is going on would be a defibrillator, an AED, automated external defibrillator. It's really important to have this because this device is a life-saving device. It is automated. It shocks the body automatically, and it saves lives of athletes.
Actually now the I-League teams and ISL teams, it has been made mandatory for them to have an AED.
I believe it should be mandatory even at the school levels because you never know when you are faced by such an uncalled for event. So I think it's...
actually every school must have at least one AED. And if you have got 5-10 floors, then you will need more because the cost of an AED and the cost of human life cannot be
cannot be
compared
compared.
at all.
Not at all.
So when you talk about preventive measures, so you will ultimately have to rely on certain protocol,
Yes,
maybe at
definitely.
lowest for the schools and the
Schools,
others.
yeah.
But as you grow, depending on what is the sport, the protocol will have to be
Different.
raised to
Raised.
that
Yes,
level.
definitely.
So you stress that screening is important.
Yes, very much. I do. I
Yes.
believe screening can actually prevent a lot of diseases. In fact, screening is one of the preventive measures that is needed in.
So, would you say that everybody who is involved in sports, not as a recreation, but in real competitive sport,
sports, yes.
what would you say that it should be done?
Implemented. Yes, definitely. It should be done at all levels, right from the grassroots level, from children, from ages of the younger stage of the children. They need to be screened because there are a lot of conditions that don't really show up when you're small, but they get noticed at much later ages. So to catch these conditions at the right time, you need to have screening from the grassroots
Yeah.
level.
So that is part A, which is essential.
Yeah.
Now, lot of athletes, they play, they get injuries,
Yes.
and for them it's a minor thing, and they ignore it, and then later on in life,
Yeah.
they aggravate and they say, my God, I never thought that, this would lead to such a problem.
Problems, yes.
So if injuries do happen, do occur, what is your message?
I think first is if you're injured, you need to go to a proper good professional to get help for that particular injury. I think injuries should not be neglected, even if it starts off just as an ache and pain. Obviously, you can definitely wait to see if it passes, but if it sticks around and does not pass, I think it's really important you go to a medical professional to get the right help.
It would be always advisable, even
yes.
if it is a minor.
Yes,
Because you
much.
never know when complications could arise, and
People tend to mostly focus on the grave injuries like muscle tears or fractures or ligament tears that really gets noticed, but there's a lot of unnoticed injuries like bursitis or tendinopathies, which starts off as very minor aches and pains but can eventually progress to a big problem which will decrease the performance of the athlete.
so ultimately it affects your performance.
Definitely.
And if you are a professional, you would want
Yes.
more money.
Yeah. Yes,
And if
very
you don't
much.
perform, you know what happens.
Yes, exactly.
Basically, footballers in Goa, in India, they have been complaining of ACL,
Yes.
anterior cruciate
Cruciate
ligament.
yes.
And problems normally in sports is your tendons, is your ligaments, your muscle,
muscles,
and
bones.
things like that.
Yes.
And I know that they have been, the physios have been relying on the formula PRICE, PRICE, and ICE application.
Yes.
Has there been any change in this treatment?
Of late, it was initially it was rice, but now it has been made police.
Police.
Police, yes, because police is protection of the limb, of the injured limb or of the injured
So
part.
at that moment you don't see that you immobilize it at that moment.
You do. That is basically what is protection. You have to immobilize initially because if, for example, if it's a fracture or a ligament tear, if you mobilize it, it could worsen. But you have to. That's why you protect it. The second thing is POL. OL is optimum loading. So optimum loading basically means you optimally allow that particular part to exercise. You do give some amount of exercise. Depending, however, this whole abbreviation is dependent on what injury has actually
So
occurred.
that would need an expert to advise. Like sports medicine, you say you are an expert.
Exactly.
So you have to go to a specialist.
Yes, definitely. So that's why you need to optimally load, and that's what a professional will be able to help you. What exercise is right for that particular injury, because different injuries, some injuries you can actually perform a lot more, whereas some injuries you're just supposed to actually immobilize. So the optimum amount of loading is important.
So POL.
Yeah. Then is ice, compression, and elevation.
Yes. So that stands.
That stands.
Yeah.
Ice. However, now of late there has been a lot of controversy about application of ice.
Is it?
Yes, because ice actually impairs inflammation, and inflammation is necessary for healing. But however, there's this, it's a very controversial, I couldn't lean towards saying ice should not be applied, because ice actually, like in patients who are non-compliant, it decreases pain. It helps in patient feels much better after application.
And
of
swelling
ice.
also
Swelling,
is
exactly.
reduced.
So ice can be really good and really bad at the same time. So you need to optimally use ice.
Yeah, so you need an expert to advise
help
you.
Exactly.
I have seen footballers. The match is over.
Exactly.
And there is an ice bucket, water, and they immerse themselves, the whole body, in ice water.
Well, in my opinion, I don't think that would be something that is very advisable. Even though this is being done at a professional level. Even because I'm a basketball player, I watch a lot of the NBA, and even the NBA athletes at that level do it. But it's still, like I said, it's a very controversial topic of application of ice. So, and a lot of research still needs to be done on this topic, whether it actually benefits all the ice application post a match. Does it really benefit an athlete, or is it only hampering their healing process?
Yeah, because I have not seen them measuring the quantity. And it is just pour ice cubes, pour. You don't measure the temperature of the water.
Yeah,
and
no.
these guys get immersed in that,
yeah.
and nobody knows the after effects.
Yeah, exactly. But ice can actually be very helpful in terms of some injuries, because sometimes there is over-inflammation, which causes excessive pain and swelling, which helps in healing, but the excess is not really required. So to curtail that excess inflammation, ice can really help.
It does help.
It does help.
It does help.
So that's why I'm saying there is a lot of controversy, and it's still not decided as to what is the right amount of ice, or what should be the protocol of ice application. But I think eventually in the near future we should have some studies done.
Yes,
some research.
You had a problem with your knee.
Yes.
Could you explain how it happened? Maybe overuse or whatever it is.
Yes.
And then what did you do? And what is the situation now?
Yeah. So I had an ACL tear in my right knee, and it happened while I was playing basketball. I happened to be running very fast, and I had a sudden stop and change in direction. That's one of the mechanism of injury of an ACL rupture. So that's what happened to me. This happened in the year 2020, during COVID, and then I had to get operated for it.
So you underwent an operation?
Surgery, yes, in my knee. Now again, whether you're supposed to get operated for an ACL tear, if it's complete and you're an athlete, it's very advisable that you do get. Then if it's partial and it's not, and you're not an athlete, you might, you could do conservative treatment and not really get operated if it's only a partial tear and you're not an athlete.
But the expert will decide
all
will
that.
decide
Yeah.
on that.
So after the surgery, I had to go through rehabilitation, which is a really long process. And even though I was studying to be a professional at that point, but I was not a professional yet, so I had to get help. Even I myself went to for the rehabilitation process. Even though I knew what to do myself, I had to take advice from other professionals, because I cannot treat myself. I need someone else to treat me. Of course, I can do it to some extent, but you always need someone with more experience and help.
And now, how are you feeling? Do you feel that you are back to that original self of yours?
Yes, very much. I feel I actually recently played a tournament in December, a basketball tournament, which was very good, and we even made it to the finals. So yeah, I think my leg's pretty good right now.
Yeah. But basically, you have been talking about conditioning and strengthening.
Yes.
Do you think that it is essential?
Yes, very much. Strengthening and conditioning is absolutely important. Conditioning of muscles, conditioning of tendons especially, because sometimes, like for example, people who go to the gym, they lift a lot of weights and they start increasing their weights very rapidly. Your muscle gets stronger very fast. Your muscle is actually able to lift these weights, but your tendons are not.
So in other words, you will need an expert
exactly.
to advise you what you start with, how you grow, and then you have to measure. So is this happening, do you think, in Goa?
Right now, I would say it's very limited places maybe, but in general, if you ask it a general question, I would say no.
When you develop your own clinic, Would you offer all these services?
Very much. I would, like I said initially, I would welcome anybody, any athlete who would want, who has, even if it's just a question about what they should do about an injury and they don't even require treatment, I would like to answer and help anybody. And I would also like to start something that would help all sportsmen and athletes at a grassroots level, probably from the school level. But those are plans for the future. And
yeah. So unless you have a pre-season conditioning, that's what everybody does.
Yes.
And don't you think so that these teams overnight that they go for nationals, schools, colleges?
Yes.
You gather 12, 15 people. Come, we have to go. Maybe 3 or 4 days. They just practice. Do you recall during your college or school days where anybody tested you physically?
No, I've personally gone for 3 nationals. I've represented Goa twice at the senior level and once at school national level, but not once we were examined by any medical professional. No.
But of late now, those who are playing, thank God there has not been a major problem. But eventually now what we see, the trend now, and problems in hereditary, genetic problems and things like that, they could emerge in such a situation and put the organizers in a fix.
Yes, that's exactly why a medical professional is absolutely important. The screening is absolutely necessary before they go. At least at the national level and the school level, there has to be some person who screens athletes, because now these days, with the amount of the kinds of food youngsters we eat is basically putting us at a higher risk for injuries.
So you'll need also a nutritionist and a dietitian.
Yes, very much. But I mean, you definitely need, they are very important. A dietitian is really...
Perhaps they would concentrate once the injury is there.
Yes.
Before that they say everything is okay. Especially you have ultra processed food now that they have. Then it does not help in healing, in recovery and all that.
Yes, exactly. You should eat more natural foods and eat healthy, basically.
So will you be able to give an overall advice to sportsmen and athletes? The concept of what is fitness?
Yes, definitely. I would say that athletes need to eat healthy, to get enough rest, and also get screened if they have any issue like any pains, aches, any kind of injury. I think they would have to get themselves screened and assessed by a medical professional and make sure. And one most important thing I would like to stress on is athletes is once they get injured, it doesn't mean that their career is over. There is something that I would love to stress on. It's called return to sport. It's rehabilitation. After any injury that occurs, an athlete can always get back to sport unless it's some really gruesome and an injury, and the chances of that are not so high. Most injuries right now are treatable, and almost all athletes, from whatever injuries they suffer, they can get back into sports.
They can recover fully.
Yeah. Even though there are re-injury rates that are quite high, it does not mean that they should completely stop playing a particular sport. I think that there is always scope for them to get back. There's always scope for them to perform and even emerge victorious post-injury.
So they shouldn't put it off once you get an injury.
Exactly, and they should not.
But you need a good expert.
Yes.
You need a good expert. Because as of now, medical certificates are being issued without examination sometimes. And we need to realize that you can be put into a lot of trouble if you really don't examine on certain parameters that are needed for performance, especially from your body.
Yes, very much.
And we have also concussion injuries also in football whenever they go for heading. In basketball also, I think there can be. Yes. So what would you suggest in such a situation?
Concussions are very serious injuries. That's why you need a medical professional on pitch side while the game is going on, because if someone has suffered a concussion, the medical professional needs to make a decision. If he has actually suffered a concussion, he cannot be going back on the field to play. But if it's just a minor injury where he's just like scraped his head on the floor but not really made hard contact.
But it's quite a risky affair.
If it's not really a concussion, then maybe he might be allowed to play again.
So if the teams or organizers cannot
Yeah.
afford to have neither a sports medicine qualified person
Yes.
nor an orthopedist person or a physiotherapist for that. Don't you think so that for every match there should be an ambulance ready?
Yes, I think so. At least if the
Can
teams,
you say that this is a big match, higher quality, and the lower level, does it work on that
no,
matter?
I wouldn't say, because professional athletes are actually more careful with injuries. But at the lower level, when training is at a lower level, they're actually more prone to injuries. Just because a certain tournament is at a professional level doesn't mean that, oh, you need medical cover only for that tournament. In fact, the lower levels need it all the more, because they are not playing at a good level where they can avoid injuries, or they know, or they've gone through particular training of how to avoid particular injuries. So they need that, the ambulance, the doctors, and the medical professionals.
But
all the more.
let us take a practical situation in Goa.
Yeah,
At the lowest level, there's nobody available.
yeah, that's
You take the tournaments at the inter-school level,
yeah,
and there is no ambulance,
no.
and something happens, God forbid.
yeah.
There have been no tragedies so far, but
Yeah.
you would say that at least an ambulance has to be a
Has to be
must.
yes, I think so. There should be one ambulance for any tournament that's going on.
Yes.
And I think the government should take initiatives to implement such ideas and get ambulances where they're required.
So I think you have shed good light on the need of a specialized treatment that can be done mostly by a specialist in the medical field.
Yes.
Dr. Nihal, thank you very much for being here
you,
with
Mr.
us. We will meet and we will have better, greater, higher discussions in the future, and we wish you all success in what you are planning. Thank you very much
Thank you,
for
Mr.
being
Jovito.
with us.
Yeah, thank you, Mr. Jovito.